The parking lot behind Station 19 is empty, except for two figures standing under a flickering sodium lamp. It's 11:47 p.m., end of shift, and the air smells like diesel and old coffee. Deputy Chief Ryan Kovac holds a manila folder in one hand, personnel termination form visible through the transparent sleeve. Maggie Brennan stands 3 feet away, still in her navy blue uniform shirt with the EMS patch on the shoulder. Her silver hair is pulled back tight. Her hands rest at her sides, still, like he's at attention without meaning to be. Kovac speaks first, effective immediately. "I'm sorry, Maggie, but the numbers don't lie." She doesn't move, just watches him. Her face shows nothing. He shifts his weight, looks down at the folder like it might give him better words. "Your scene times are consistently 8 to 12 minutes longer than department average. That's not an opinion, it's data. We've got performance standards now. Metrics. The city's watching our response efficiency, and we can't afford outliers." Maggie's voice is quiet, even. 8 minutes to make sure I'm not missing something that'll kill them in the ambulance. Kovac shakes his head. "That's not how modern EMS works anymore. Load and go, treat en route. You know this. We've had the trainings. I also know what happens when you move someone too fast." "You're 71 years old, Maggie." There it is. The real reason finally said out loud. "Your reflexes aren't what they were. I've seen you take twice as long to establish an IV. Fire crews are complaining you slow down extrications. Last month you requested manual BP checks instead of using the monitor. Because the monitor was giving me a false read on a hypothermic patient." "You don't know that. I do." Kovac closes the folder. "I'm not arguing with you. This is done. You've got 24 hours left on the schedule. Tomorrow's your last shift. After that, you'll receive pension information and Cobra healthcare options in the mail." He walks toward his department SUV, stops, turns back. "For what it's worth, you were a good medic. 22 years is a solid career, but the job's changed. It's time." He drives away. Maggie stands alone under the light. She looks down at her hands. The knuckles are thicker than they used to be, the veins more pronounced. There's a scar across the base of her left thumb, old and faded. Another along the inside of her right wrist, just below a small tattoo most people never notice. She exhales slowly, picks up her gear bag from the bench, walks to her truck. Inside, she sits in the driver's seat without starting the engine. The station lights are still on behind her. Through the bay windows, she can see the night crew prepping the ambulance for their shift. She remembers when she started here. 1998. She was 49 years old, and people asked why she was beginning a career most people retired from. She never told them the real answer. She turns the key, the engine starts. "Before we begin, tell us where you are watching from. And if you want to support the channel, please subscribe and hit the like button on this video." 6 months earlier, same station, different season. Spring rain, coming down in sheets. The kind that turns every call into a mud pit and makes gear twice as heavy. Maggie and her partner then, a guy named Tony DeLuca, were returning from a nursing home transfer. Routine. Non-emergency. An 80-something with pneumonia going to the hospital for admission. Kovac was waiting in the bay when they backed in. He had a clipboard. That was never good. "Brennan, my office." Tony shot her a look. She shrugged, followed Kovac inside. His office smelled like energy drinks and printed paper. He sat behind his desk, didn't ask her to sit. "Your average scene time last quarter was 14 minutes. Department standard is 6. Maggie kept her face neutral. "I do full assessments. You do unnecessary assessments. Last week, that diabetic emergency, you spent 11 minutes on scene doing a neuro exam for a low blood sugar. Fire had already checked glucose. It was a basic hypoglycemic. You should have been en route in 4 minutes." He had a facial droop. From the hypoglycemia. From the stroke he was having at the same time. Kovac leaned back. That's not what Fire reported. Fire's not doing the hospital handoff, IN. And when we got there, CT confirmed an ischemic stroke. If I'd just pushed sugar and gone home, he'd have been outside the thrombolytic window. Kovac tapped his pen against the desk. "You're getting demoted, back to street medic. No more supervisor shifts. And you're getting a new partner, someone who can keep pace." That's how she got paired with Jesse Park. 28 years old, former Army medic. 2 deployments to Afghanistan, quiet in the way people who've seen things are quiet. Their first shift together, Jesse watched Maggie work a chest pain call. 56-year-old male, classic presentation, radiating pain down the left arm, diaphoretic, nauseous. Maggie did everything by the book. IV, oxygen, aspirin, nitro, 12-lead EKG showing ST elevation in the inferior leads. STEMI alert called to the hospital. Patient in a cath lab 14 minutes after arrival. Textbook save, but Jesse noticed something else. The way Maggie's hands moved when she started the IV. No wasted motion. The way she tilted the patient's wrist just slightly, felt for the vein with her fingertip before ever touching the catheter. The way she secured the line with tape in a specific cross pattern. After the call, Jesse asked her, "Where'd you learn to start lines like that?" Maggie was restocking the drug box. "Practice." "No, I've seen practice. That's muscle memory from volume. You've done that exact motion thousands of times." Maggie didn't look up. "I've been doing this a long time." Jesse let it drop, but didn't stop watching. If you want to see how a 71-year-old paramedic uses a forgotten battlefield technique to bring back the dead, make sure you subscribe to Emergency Heroes Stories. Now it's her last shift. She arrives at the station at 6:48 a.m. 12-hour shift, 0700 to 1900. Then it's over. Jesse's already there, checking the rig. He looks up when she walks in, nods. "Heard the news?" "Yeah. It's bullshit." Maggie opens the side compartment, starts her own equipment check, even though Jesse's already done it. "It's done. You gonna fight it?" "No point." Jesse watches her count airway supplies, reorganize the intubation kit so the bougie is on top, where she can reach it in 3 seconds instead of 5. "You do that every shift." "Do what?" "Rearrange everything, like you're setting up for something specific." Maggie closes the compartment. Just preference. The radio crackles. Dispatch voice, calm and automated. "Unit 19, respond to 4738 Maple Street for a medical emergency. 72-year-old female, diabetic, unresponsive." Jesse keys the mic. "Unit 19 en route." Maggie climbs into the passenger seat. She pulls on her gloves, the nitrile snapping against her wrists. Jesse drives. Lights, no siren yet. Residential area, early morning, not much traffic. "You ever think about what you'll do after?" he asks. Maggie looks out the window. "Not really." "You should. You're too good to just disappear." She doesn't answer. They arrive on scene in 6 minutes. The house is a single-story ranch with brown siding and a chain-link fence. The front door is open. A middle-aged woman stands on the porch, waving them in. Maggie grabs the jump bag. Jesse takes the monitor and oxygen. Inside, the air is stale and warm. Too warm. The thermostat reads 84 degrees. An elderly woman is lying on the couch, unresponsive. Her breathing is shallow, fast. Her skin is pale and wet with sweat. The daughter is talking, rapid fire. "She didn't eat breakfast. I came over to check on her, and she was like this. She's diabetic. She takes insulin. Sometimes she forgets to eat." Jesse is already pulling out the glucometer. He pricks her finger, waits for the reading. Glucose is 38, definite hypoglycemia. Maggie kneels beside the patient. She doesn't touch her yet, just looks. The woman's face is slack on one side. The left corner of her mouth droops lower than the right. Her left eyelid doesn't close all the way. Jesse is preparing the IV kit, getting ready to push dextrose. Maggie puts a hand on his arm. "Wait." He stops, looks at her. Maggie leans closer to the patient. She takes the woman's left hand, lifts it 6 inches off the couch, releases. Releases it. The arm drops, limp. No resistance. Then the right hand. Same test. This time, the arm drifts downwards slowly, with slight resistance. Maggie moves to the woman's feet. She runs the back of a pen along the sole of the left foot. The toes curl downward. Normal reflex. Right foot. The big toe extends upward. Babinski sign. Jesse sees it too. Maggie speaks quietly. She's having a stroke. The daughter's voice spikes. "No, it's her sugar. This has happened before." "It's both." Jesse is already on the radio, calling it in. "Dispatch, Unit 19 on scene at 4738 Maple. We have a 72-year-old female, unresponsive, glucose 38, but also showing left-sided facial droop, left arm drift, and positive Babinski on the right, requesting stroke alert activation at Regional Medical." Dispatch confirms. Maggie starts the IV. 18 gauge in the right AC. She tapes it down in a crosshatch pattern, fast and tight. Jesse pushes 25 grams of D50. The thick, clear glucose solution moves through the line. Within 90 seconds, the woman's eyes flutter open. Her breathing deepens, but the facial droop doesn't change. Jesse checks the time on his watch. Last known normal was about 40 minutes ago, according to the daughter. Maggie nods, still within the window for thrombolytics if the CT is clear. They load the patient onto the stretcher. Jesse drives, lights and sirens now. Maggie rides in the back, monitoring. The woman is awake, confused, trying to talk. Her speech is slurred, words thick and slow. Maggie holds her hand. "You're okay. We're taking you to the hospital. Stay calm." At Regional Medical, Dr. Amara Okonkwo is waiting at the ambulance bay. She's tall, moves with precise efficiency, her white coat spotless even at this hour. Maggie gives the report while they roll inside. 72-year-old female, diabetic. Found unresponsive with glucose of 38. Corrected with D50. Patient also presenting with left facial droop, left arm weakness, positive Babinski on right foot. Last known normal, approximately 50 minutes ago. No prior stroke history. She's on metformin and Lantus, no anticoagulants. Dr. Okonkwo is already examining the patient as they move. Good catch. Fire called this in as a diabetic emergency. Maggie doesn't respond to that. They transfer the patient to the ER bed. The CT tech is waiting. The woman is rushed down the hall. Dr. Okonkwo stops Maggie before she leads. "You did the full neuro exam on scene?" "Yes." Most medics would have just treated the sugar and cleared. Most medics would have missed it. Dr. Okonkwo nods slowly. "How long have you been doing this?" "Long enough." Maggie walks back to the rig. Jesse is cleaning the stretcher, restocking. He looks up. "Fire captain radioed while you were inside. Said we took too long on scene." "How long?" 11 minutes. Maggie pulls off her gloves, tosses them in the trash. She needed 11 minutes. Jesse grins slightly. "I know. I'm just telling you what he said." They clear the hospital, drive back toward their coverage area. The radio stays quiet for 20 minutes. Then dispatch sends them to a minor MVA. 2 vehicles, low speed, no injuries reported, but one driver complaining of neck pain. They arrive. A sedan and a pickup truck, bumpers kissed, barely any damage. The driver of the sedan is a man in his 30s, sitting on the curb, holding his neck. Fire is already there. The captain, a guy named Rourke, waves them over. Probably nothing. He's just making sure he's covered for insurance. Maggie approaches the patient, kneels down to his level. "Where does it hurt?" "My neck and my shoulder. The seatbelt. Any headache? Dizziness? Nausea?" "No, just sore." Maggie asks him to turn his head slowly. He does. No obvious deformity, no crepitus. She palpates the cervical spine. No tenderness. "Any numbness or tingling in your arms or legs?" "No." She looks at his eyes. Pupils equal and reactive. She checks his grip strength, has him squeeze her hands. Firm, symmetrical. Then she places her hand flat on his upper abdomen, just below the rib cage on the left side. "Take a deep breath for me." He does. Maggie feels the expansion, the way the diaphragm pushes downward. But there's something else. A firmness. A subtle resistance. Resistance that shouldn't be there. She presses gently, deeper. The man winces. "Ow. Yeah, that's tender." Maggie pulls her hand back, looks at Jesse. "You're transporting." Rourke frowns. "For neck pain? Come on, Brennan. This is a refusal waiting to happen." Maggie ignores him, turns to the patient. "I want to get you checked out at the hospital. You've got some tenderness in your abdomen that concerns me." "I feel fine." "You might not in an hour." Jesse is already pulling the stretcher out. He trusts her. The patient agrees reluctantly. They load him up. Maggie starts an IV en route, just in case. She rechecks his vitals every 5 minutes. Blood pressure starts at 128/82. Normal. 15 minutes later, it's 118/78. 20 minutes later, 104/70. The patient is starting to look pale. "I feel weird," he says. Maggie increases the IV flow rate, keeps him flat. "Stay with me. We're almost there." They roll into Regional Medical. Dr. Okonkwo is still on shift. Maggie gives her the rundown. Low-speed MVA, initially complaining of neck and shoulder pain. "On my exam, he had left upper quadrant tenderness. Blood pressure has been dropping steadily en route. Started at 128 systolic, now 98. Dr. Okonkwo's expression sharpens. She moves fast, orders a fast exam, the bedside ultrasound. 10 minutes later, she finds Maggie in the hallway. Splenic rupture. Free fluid in the abdomen. He's going to surgery now. Jesse is standing nearby, hears it. Dr. Okonkwo continues. If you hadn't caught that, he would have gone home, ruptured completely in a few hours, and bled out before anyone knew what was happening. Maggie just nods. Glad he's okay. Dr. Okonkwo watches her walk away, then looks at Jesse. She always like this? Yeah. Where'd she train? Jesse hesitates. I don't actually know. Back in the rig, Jesse is staring at Maggie like he's trying to solve a puzzle. You felt that. The spleen. You knew. Maggie is writing her report. I suspected. How? Mechanism of injury. Seatbelt across the abdomen. Tenderness on palpation. Falling BP. It's not magic. It's not standard protocol either. Maggie looks at him. Protocol is a baseline. It's not a ceiling. Jesse leans back, shakes his head. Kovac is an idiot for letting you go. Maggie doesn't answer. She just finishes her report, closes the laptop. The radio crackles again. Dispatch sends them to another call, then another. The shift continues. It's 2:37 p.m. They've been running calls since morning with no break. Maggie hasn't eaten. Jesse grabbed a protein bar between transports. The radio goes off again. Unit 19, respond to 1247 Industrial Park Drive for a workplace injury. 34-year-old male, laceration to the forearm, bleeding controlled. Jesse keys up. Unit 19 en route. It's a fabrication shop. Metal cutting, welding, heavy machinery. The kind of place where injuries happen quiet and quick. They walk inside. The air smells like burning metal and cutting oil. Sparks fly from a grinder in the corner. The patient is sitting on a folding chair near the back office. His right forearm is wrapped in a shop towel, already soaked red. Another worker is holding pressure. Maggie sets the bag down, kneels beside him. What happened? Caught it on a sharp edge, sheet metal, sliced right through. Let me see. A coworker pulls the towel away. The laceration runs diagonal across the forearm, about 4 inches long, deep enough that Maggie can see the pale fascia beneath the subcutaneous fat. It's still bleeding, but slow now. Venous, not arterial. She irrigates it with saline, examines the wound edges. Clean cut, no jagged tearing. Can you make a fist? He does. All fingers move, no tendon damage. Feel this? She touches each fingertip lightly. Yeah, no nerve involvement. Jesse has the bandages ready. Maggie packs the wound with sterile gauze, wraps it snug with rolled gauze, then secures it with a pressure dressing. You're going to need stitches, probably 15, maybe 20. The guy nods. Can you do it here? No, hospital. They load him into the rig, non-emergency transport. Jesse drives without lights. At the hospital, they wheel him into the ER. It's busy now. Afternoon rush. All the beds are full. A nurse directs them to a room in the back corner. Dr. Okonkwo walks past, sees Maggie, stops. You're still here? Last shift. Dr. Okonkwo glances at the patient, sees the wrapped arm. Lack. 4 inches, forearm, clean edge, no tendon or nerve involvement. Dr. Okonkwo pulls the dressing back slightly. Looks. Deep. You pack it? Yes. Good. She pauses. You ever do sutures? Used to. Or slam. If you've got the skills and the time, I can authorize it under my license. Save him 2 hours waiting. Maggie looks at Jesse. He shrugs. We're clear right now. Maggie nods. Dr. Okonkwo brings the suture kit. Lidocaine, curved needle, 4-0 nylon. Standard laceration tray. Maggie washes her hands, puts on sterile gloves. She opens the kit, arranges the instruments without looking. Needle driver, forceps, scissors. The patient watches her. You do this a lot? I've done it before. She injects the lidocaine along the wound edges, slow and steady. Waits 2 minutes for it to take effect. Tests the area with the forceps tip. Feel that? No. She starts. The first stitch goes in smooth. She enters the skin at a 90-degree angle, curves the needle through the dermis, exits on the other side symmetrically. The knot is square, tight but not strangulating. She cuts the tails short. Jessie is watching from the doorway. Her hands don't hesitate. Every motion is controlled. The needle driver moves like it's part of her hand. Second stitch, third, fourth. A nurse walks by, glances in, stops. Who's doing the repair? Jessie answers quietly. She is. The nurse steps closer, watches. Maggie works in silence. Her breathing is even. She doesn't rush. Each stitch is placed with the same precision as the last. By the 8th stitch, 2 more staff members have paused outside the room. One of them whispers, "Is that the paramedic?" Yeah. Where'd she learn to suture like that? No one answers. Maggie finishes the deep layer, starts the superficial closure. The edges line up perfectly. No gaps, no tension. 16th stitch, 17th. She ties off the last one, cuts the thread, steps back. The wound is closed. The suture line is clean, almost invisible under the dried blood. She irrigates it again, pats it dry, applies antibiotic ointment and a non-stick dressing. Keep it dry for 48 hours. Come back in 10 days to get the stitches out. The patient looks down at his arm. That's it? That's it. Dr. Okonkwo walks back in, examines the closure. She doesn't say anything for a few seconds, just looks. Then she turns to Maggie. That's surgical level work. Maggie is stripping off the gloves. It's just a lac repair. No, that's technique. Needle angle, bite depth, symmetry. That's not something you learn from a weekend course. Maggie doesn't respond. She picks up the used instruments, drops them in the sharps container. Dr. Okonkwo crosses her arms. How long have you been a paramedic? 22 years. And before that? Maggie meets her eyes. Before that doesn't matter. She walks out. Jesse follows her to the rig. They climb in. He starts the engine, but doesn't shift into gear yet. You gonna tell me? Tell you what? Where you learn to suture like that, and start IVs like that, and assess patients like that. Maggie looks out the window. I've been doing this a long time. That's not an answer. She turns to him. It's the only one you're getting. Jesse shifts into drive. They clear the hospital, head back into service. The radio is quiet for 10 minutes. Then dispatch breaks the silence. All units, stand by for priority traffic. Jesse turns up the volume. Dispatch continues, tone shifted now. Faster, sharper. Multiple units respond to 8200 block of Riverside Boulevard for a major structural collapse. Construction site. Reports of multiple workers trapped. Fire, EMS, and rescue responding. This is a mass casualty incident. Repeat, mass casualty incident. Jesse looks at Maggie. She's already reaching for the radio. Unit 19, we're en route. He hits the lights and siren. The engine roars. Maggie opens the side compartment from the inside, starts pulling out additional trauma supplies, extra gauze, tourniquets, chest seals. She lines them up on the bench seat, within arm's reach. Jesse glances back. You think it's bad? Structural collapse with multiple trapped? Yeah, it's bad. They merge onto the main road. Traffic pulls to the side. The siren wails. Maggie's face is calm. Her hands move methodically, checking equipment, prepping supplies. Jesse sees it now, the transformation. This isn't a 71-year-old woman on her last shift. This is someone who's done this before, somewhere else, under worse conditions. He doesn't ask again. They arrive on scene in 8 minutes. The construction site is chaos. A 12-story steel frame building, halfway through construction. The east side has collapsed. Twisted metal beams jutting out at angles. Concrete slabs cracked and tilted. Dust still hanging in the air, thick and choking. Workers are running, screaming. Some are being let out by firefighters, limping, bleeding. Incident command is setting up near the main gate. Kovac is there, radio in hand, trying to organize the response. Fire trucks, ambulances, police cars, all converging. Maggie and Jesse grab their gear, move toward the staging area. Kovac sees Maggie. His face flashes with something. Surprise, maybe annoyance, but he doesn't have time to deal with it. Brennan, Park, you're on triage. Red tags to the ambulances, yellow tags to the treatment area. Green tags walk themselves out. Go. Maggie nods, turns toward the site. Jesse stays close. They move into the debris field. The first patient is sitting on the ground, holding his head. Blood runs down his face from a scalp lac. He's conscious, talking. Maggie tags him yellow, points him toward the treatment area. Second patient. Compound fracture, tibia, bone visible. He's screaming. Red tag. Jesse calls for a stretcher. Third patient. Unconscious, chest not rising. Maggie kneels, checks for a pulse. Nothing. Black tag. She moves on. Fourth, fifth, sixth. Yellow, green, red. The chaos is immense, but Maggie moves through it like water. Calm, focused, seeing everything. Jesse is right behind her, following her lead. Then they hear it. A voice, weak, coming from under a section of collapsed scaffolding. Help, someone, please. Maggie moves toward it. If this story is keeping you on edge, hit subscribe, because what happens next will redefine impossible. Maggie moves toward the voice. Jesse follows, stepping carefully over twisted rebar and chunks of concrete. The scaffolding is collapsed inward, creating a narrow pocket beneath. Through a gap in the metal framework, they can see him. A man, young, maybe late 20s, lying on his side, pinned from the waist down by a steel beam. His hard hat is cracked. His face is pale, streaked with dust and sweat. But what stops Maggie cold is the rebar. It's pierced through his right chest, just below the collarbone. The metal rod is maybe 3/4 of an inch thick, rusted at the edges. It entered from the front and exits somewhere behind him, buried in the debris. He's conscious. His eyes find hers. I can't move. Maggie drops to her knees at the edge of the gap, assessing the space. It's too tight for a stretcher, barely wide enough for a person. What's your name? Derek. Derek Moss. Derek, I'm Maggie. This is Jesse. We're going to get you out. His breathing is fast, shallow. Each breath makes a wet sound, faint but there. Jesse is already on the radio, calling for heavy rescue. Command, this is Park. We have a critical patient, trapped under scaffolding, impaled by rebar through the chest. We need extrication now. Kovac's voice crackles back. Copy. Rescue team is tied up on the main collapse. ETA, 15 minutes. Jesse looks at Maggie. 15 minutes might as well be an hour. Maggie crawls closer, into the gap. Her shoulders barely fit. She reaches Derek, kneels beside him in the tight space. She places 2 fingers on his neck. Pulse is there. Rapid, thready. 130, maybe 140. His lips are starting to turn dusky. She listens to his chest. The left side has breath sounds, diminished, but present. The right side is almost silent. Pneumothorax. The lung is collapsing. But there's something else. She places her palm flat on his chest, feels the movement. Each heartbeat is muffled, like it's beating against resistance. Ants, pericardial effusion. Blood pooling around the heart. She pulls back slightly, looks at the rebar. It's angled downward, likely penetrated the pericardium. If they move him, if they pull that metal out, he could bleed out in seconds. But if they don't move him, he'll die here. Jesse is beside her now, squeezed into the gap. What do you need? Maggie doesn't answer immediately. She's calculating, running through options. Derek's voice is weaker now. I can't breathe right. I know. Stay with me, Derek. Fire Captain Rourke appears at the edge of the collapse, looking in. We can't move this scaffolding without destabilizing the whole section. If we cut the rebar, the vibration could shift everything. He'll be crushed. Maggie looks up at him. Then we stabilize him here and wait for extrication. Rourke shakes his head. 15 minutes minimum, maybe longer. Jesse is watching Derek's chest. The breathing is getting worse, more labored. Then Derek's eyes roll back. His body goes limp. Jesse checks the carotid pulse. I've got nothing. Maggie moves fast. She positions herself at Derek's head, tilts it back slightly to open the airway. But she can't do compressions. The rebar is in the way. Any pressure on the chest could drive it deeper, shred the heart completely. Jesse sees the problem. We can't compress. What do we do? Maggie's mind is racing. Standard ACLS is useless here. Everything she's been trained to do in the last 22 years won't work. But there's something else. Something older, a memory. Distant but sharp. Kaysan, 1968. A Marine with a punji stick through his chest. No way to evacuate. No surgeon. Just her, a pair of hemostats and a syringe. She did something then that wasn't in any manual. She looks at Jesse. I need a 14-gauge needle, the longest one we have, and a 60cc syringe. Jesse doesn't hesitate. He crawls back out, runs to the rig. Rourke is still watching. What are you doing? Maggie doesn't answer. She's feeling Derek's chest again, fingertips tracing the anatomy beneath the skin, finding landmarks, the xiphoid process, the 5th intercostal space. Jesse returns, hands her the needle and syringe. Maggie assembles them, checks the plunger. Rourke's voice is sharper now. Brennan, what the hell are you doing? Pericardiocentesis. His eyes widen. That's not a field procedure. You'll kill him. He's already dead. She positions the needle at the subxiphoid angle, just below the sternum. The angle has to be perfect. Too steep and she punctures the liver. Too shallow and she misses the pericardium entirely. She closes her eyes for half a second. Visualizes the anatomy. The heart sitting in its sac, compressed by blood that has nowhere to go. Then she pushes the needle in. Slow, controlled. She feels the resistance of skin. Then fascia, Then the tough fibrous pericardium. A pop, subtle but distinct. She's in. She pulls back on the plunger. Dark red blood fills the syringe. Not bright, not oxygenated. This is blood that's been sitting, compressing the heart, choking it. She pulls 40 cc's, then 50. Derek's chest rises suddenly, a gasping breath. Jesse checks the pulse. I've got something. Weak, but it's there. Maggie withdraws the needle, places her hand over the insertion site. Garrick's eyes flutter open, confused, terrified. Stay still, Maggie says. You're okay. Rourke is staring, speechless. Jesse is looking at Maggie, like he's seeing her for the first time. Where did you learn that? Maggie doesn't answer. She's already moving to the next problem. Derek's right chest, the pneumothorax. She needs to decompress it, but she can't do a standard needle thoracostomy with the rebar in the way. She looks at Jesse. I need your trauma shears and a gloved finger. He hands her the shears. She cuts away Derek's shirt, exposing the chest wall. She finds the 5th intercostal space, mid-axillary line. Left side, away from the rebar. No needle this time. No catheter. She's going to do it the old way. She makes a small incision with the shears, just through the skin. Then she bluntly dissects down with her fingertip, spreading the tissue until she feels the pleura. She punctures it with her finger. Air rushes out, a hiss, then a release. See, Derek's breathing eases immediately. Jesse is watching her hands. The precision, the confidence. This isn't improvisation. This is training. A voice comes from behind them. One of the firefighters, younger guy, early 30s. He's staring at Maggie, recognition dawning on his face. You're FMF. Maggie looks up. The firefighter steps closer. Fleet Marine Force, Corpsman. I was Army, but I worked with you guys in Helmand. I know that technique. Finger thoracostomy. They don't teach that in civilian EMS. Jesse's eyes snap to Maggie. You were military? Maggie's face is unreadable. Long time ago. The firefighter keeps talking. You just did a pericardiocentesis without ultrasound guidance, in the field, under a collapsed building. That's not just military, that's combat medicine. Rourke is still there, listening now. Kovac's voice comes over the radio. All units, we have heavy extrication equipment on site. Moving to the secondary collapse zone now. Jesse keys his radio. Command, we've got a critical patient stabilized but still impaled. We need immediate extrication. Copy. Team is moving to your location. Maggie stays with Derek, monitoring his breathing, his pulse. Both are holding. Tenuous, but holding. Jesse leans close, his voice low. You need to tell me. Who are you? Maggie looks at him, then at Derek, then back at Jesse. Right now, I'm the person keeping him alive. The heavy rescue team arrives. Saws, hydraulic cutters. They start dismantling the scaffolding piece by pulse. It takes 12 minutes. Finally, they cut the rebar on both sides of Derek's body, leaving a 6-inch section still embedded in his chest. Maggie and Jesse package him carefully. Spine board, C-collar. The rebar stabilized with bulky dressings on both sides. They carry him out together. The crowd of first responders parts as they move through. Everyone is watching. They load Derek into the ambulance. Jesse drives, lights and sirens. Maggie stays in the back, hand on Derek's wrist, feeling the pulse. He looks up at her. You saved me. Maggie shakes her head. Not yet. Stay with me. They arrive at Regional Medical in 9 minutes. The trauma team is waiting outside. Dr. Okonkwo is leading them. She sees the rebar still embedded in Derek's chest, and her expression tightens. Maggie gives the report as they roll inside. 29-year-old male. Construction worker, structural collapse. Impaled by rebar through right chest. Patient went into cardiac arrest on scene. Pericardiocentesis performed. Drained approximately 50 cc's of blood from pericardial sac. Also performed finger thoracostomy for right-sided tension pneumothorax. Patient regained pulse and respirations. Vitals have been holding. Pulse 118, respirations 22, BP 94/60. Dr. Okonkwo stops walking. The whole team stops. She looks at Maggie. You did a pericardiocentesis in the field? Without ultrasound? Yes. And a finger thoracostomy? Yes. Dr. Okonkwo doesn't say anything else. She just nods once. Then the team moves again fast into Trauma Bay 1. They transfer Derek to the hospital bed. The CT tech is already there. Portable X-ray is positioned. Maggie and Jesse step back. Let the team work. Dr. Okonkwo is calling orders. Chest X-ray. Type and cross for 6 units. Cardiothoracic surgery consult. OR prepped and standing by. Maggie watches for another moment. then turns toward the door. Kovac is standing there. His face is unreadable. He motions for her to follow him. They walk down the hallway, away from the noise. He stops in a quiet corner near the staff lounge. You want to tell me what just happened out there? Maggie crosses her arms. I stabilized a critical patient. You performed procedures that aren't in any civilian paramedic protocol. He was dead. Protocol wasn't going to bring him back. Kovac leans against the wall, looking at her closely now. I've been reviewing your personnel file since this morning, trying to understand why you do things the way you do. Maggie doesn't respond. Your application from 1998 lists your prior work experience as administrative assistant. Before that, dental office receptionist. Nothing medical. No formal training listed except your paramedic cert. He pauses. But You just watched you do something that most ER docs wouldn't attempt without imaging. And you did it under a collapsed building like it was routine. Maggie stays silent. Kovac pushes off the wall, steps closer. So I made a call. Ran your name through a different database. Not employment records. Military records. Maggie's jaw tightens, barely visible. Margaret Ann Brennan. Hospital corpsman, United States Navy. Service dates, 1968 to 1971. Assigned to 3rd Marine Division, Fleet Marine Force. 2 tours in Vietnam, Silver Star. 2 Bronze Stars with Valor. The hallway is quiet, except for the distant sound of monitors and voices. Kovac's voice drops lower. You were a combat medic. In one of the worst wars we ever fought. And you never mentioned it. Not once in 22 years. Maggie looks past him, toward the window at the end of the hall. It wasn't relevant. Wasn't relevant? You have more trauma experience than everyone in this department combined. And it wasn't relevant? That was a long time ago. Kovac steps back, shaking his head. Why didn't you say anything? When I demoted you, when I fired you, you could have told me. Maggie finally looks at him. Would it have mattered? He doesn't answer. She continues, her voice steady, cold. You didn't fire me because I lacked skills. You fired me because you thought I was too old, too slow, a liability. Telling you I was a war hero 50 years ago wouldn't have changed that. Kovac opens his mouth, then closes it. Maggie turns to walk away. Wait. She stops, doesn't turn around. Kovac's voice is quieter now. That patient, Derek Moss, he'd be dead if you hadn't been there. Everyone else on scene, including me, we would have waited for extrication and he would have died. You're the only one who knew what to do. Maggie looks back over her shoulder. So what do you want? Gratitude? Validation? I want to know why you didn't fight back when I fired you. You just accepted it. Maggie's face softens, just slightly. Not with warmth, with something heavier. Because I didn't want to be Doc anymore. Kovac frowns. Doc? That's what they called me. In Vietnam, Doc Brennan. I was 19 years old, and I was responsible for keeping kids alive in a jungle while people were trying to kill us. And most of the time, I couldn't. They'd come to me with holes in their chests, missing limbs, shrapnel in their spines, and I'd do everything I knew how to do, and they'd still die. Her voice doesn't waver, but there's weight in every word. I carried that for a long time. When I got out, I didn't want to touch another trauma patient ever again. I worked desk jobs, stayed away from medicine, but it didn't go away. So eventually, I went back, got my paramedic license, thought maybe I could do it again, differently. Civilian side, calmer. She pauses, and for 22 years I did. I was just another medic, competent, reliable, forgettable. I didn't want the attention. I didn't want to be Doc. Kovac is listening now, really listening. But today, that kid had a piece of metal through his heart, and no one else knew how to save him. So I did what I learned to do in 1968, and now everyone knows. She turns fully to face him. So no, I didn't fight you. Because part of me thought maybe it was better to just let it end, go home, be done. Kovac looks down, then back up. I was wrong. Maggie doesn't respond. I made a decision based on metrics and assumptions. I didn't see what was right in front of me, and I'm sorry. Maggie nods once, slowly. Okay. That's it? Just okay? What do you want me to say? Kovac straightens. I want you to come back. Not as a street medic, as a senior training officer. Teach what you know. Those field techniques, the assessment skills, the way you see things no one else sees. Maggie is quiet for a long moment. I'm 71 years old. And you just saved a man's life with skills most people don't even know exist. Age isn't the issue. It never was. Before Maggie can respond, Jesse comes down the hallway, moving fast. Maggie, Garrick's crashing. They run. Back in Trauma Bay 1, the monitors are screaming. Derek's blood pressure is dropping. 70/40, then 60/30. Dr. Okonkwo is at the bedside. He's bleeding. Into the chest. We need to get him to the OR now. The surgical team is rushing him toward the elevator. Maggie watches them go. Dr. Okonkwo stays behind, pulling off her gloves. She walks over to Maggie. The rebar perforated his right ventricle. There's active hemorrhage. If you hadn't decompressed the pericardium when you did, he would have been in full arrest with no chance of ROSC. You bought him the time he needed. Maggie nods, says nothing. Dr. Okonkwo continues. I've been an attending for 8 years. I've worked in level 1 trauma centers in 3 states. I've never seen a field pericardiocentesis done without imaging. That's not standard care. That's battlefield medicine. It is. Where'd you serve? Vietnam. Dr. Okonkwo's eyes widen slightly. You were a combat medic in Vietnam, and you've been running 911 calls in a mid-sized city for 2 decades. Yes. Why? Maggie looks toward the elevator where they took Derek. Because I thought I was done saving lives in impossible situations. Turns out I was wrong. Dr. Okonkwo watches her, then glances at Kovac, who's standing a few feet away. If she doesn't come back to work here, I'm hiring her for my department. Kovac almost smiles. She's already coming back. Maggie looks at both of them. I haven't agreed to anything. Jesse steps forward. You should. Maggie turns to him. You don't get a vote. Yeah, I do. Because if you're teaching, I'm learning. I've been a medic for 6 years and I thought I knew what I was doing. Then, I watched you save a guy who was clinically dead with a piece of metal through his heart. I want to know how to do that. Maggie exhales slowly. It's not something you can just teach. Then show me. Show all of us. The radio on Jesse's belt crackles. Dispatch. Unit 19, what's your status? Jesse keys up. Unit 19 is at hospital. Available in 10. He looks at Maggie. We've still got 5 hours left on shift. Maggie looks at Kovac. Am I still fired? No. Then I guess we're available. She walks toward the exit. Jesse follows. Kovac watches them go, shaking his head. Dr. Okonkwo stands beside him. You almost lost the best medic you'll ever have. I know. Don't do it again. They're back in the rig, heading toward their coverage zone. The sun is lower now, casting long shadows across the city. Jesse is driving. He keeps glancing at Maggie. Finally, he speaks. You really did 2 tours in Vietnam? Yes. How old were you? 19 when I enlisted. 22 when I got out. Jesse does the math in his head. So you're not just a veteran. You're a Vietnam veteran. You were there during some of the worst fighting. Maggie looks out the window. I was there. Khe-san. You mentioned it earlier. She's quiet for a moment. Yes. That was 1968. The siege. January to April. 77 days. Jesse exhales slowly. I read about that in training. Surrounded. Constant artillery. Casualties every day. Maggie doesn't respond. Jesse continues. Quieter now. How many? How many what? How many did you treat? Maggie closes her eyes briefly. I stopped counting after 200. The radio is silent. The city moves past them. Jesse's voice is almost a whisper. How many didn't make it? Maggie opens her eyes. Enough. He doesn't push further. They drive in silence for another minute. Then the radio crackles. Unit 19, respond to 523 Archer Street, apartment 2B. Unconscious patient, possible overdose. Jesse keys up. Unit 19 en route. He hits the lights. They're 3 minutes away. Maggie is already pulling on gloves, prepping the Narcan. They arrive at a run-down apartment complex. 2nd floor, exterior staircase. The door to 2B is open. A woman in her 40s is standing outside, frantic. He's not breathing. I think he took something. Maggie and Jesse move fast. Inside, a man is on the couch, mid-20s, blue around the lids. No chest rise. Maggie checks for a pulse. Faint. Barely there. Jesse bags him while Maggie administers 2 milligrams of Narcan intranasally. 30 seconds. Nothing. She gives another 2 milligrams. 45 seconds. The man gasps, his eyes snap open, and he jerks upright, panicked and confused. Maggie steadies him. You're okay. You overdosed. We gave you Narcan. You need to go to the hospital. He's shaking his head, trying to stand. I'm fine. I don't need a hospital. You do. Whatever you took is still in your system. The Narcan wears off in 30 to 90 minutes. If you don't go, you'll stop breathing again. He's not listening, pulls away from her, stumbles toward the door. The woman tries to stop him. Please just go with them. I say I'm fine. He leaves, down the stairs, into the street, gone. Maggie watches him go, then turns to the woman. If he comes back and stops breathing again, call 911 immediately. The woman nods, tears in her eyes. They pack up, head back to the rig. Jesse is frustrated. We just saved his life and he walks away. Maggie climbs into the passenger seat. That's the job sometimes. Doesn't it piss you off? It used to. They clear the scene, return to service. The rest of the shift is routine. Chest pain, abdominal pain, a fall, an asthma attack, nothing extraordinary. By 6:30 p.m., they're back at the station, restocking and cleaning the rig. Other crews are there now, starting the night shift. Word has already spread about what happened at the construction site. A young paramedic, maybe 25, approaches Maggie. Is it true? You did a pericardiocentesis without ultrasound? Maggie doesn't look up from the cabinet she's organizing. Yes. How? I mean, how did you know where to go? Anatomy, landmarks, practice. But without imaging, you could have punctured the liver, or the heart itself, or I didn't. The young medic is quiet for a moment. Could you teach that? Maggie closes the cabinet, looks at him. It's not about the procedure. It's about knowing when to do it. And that only comes from seeing enough people die when you don't. She walks away, leaving him standing there. Jesse finishes the paperwork, logs off the computer. Maggie is outside, leaning against the rig, looking at the sky. It's turning orange and purple now, the last light of the day. Jesse joins her. You thinking about coming back? I don't know. Kovac was serious. Training officer, you'd be teaching the next generation. Maggie doesn't answer immediately. Jesse continues. I deployed twice, saw things I'll never forget. And when I came back, I didn't know what to do with it. I didn't want to talk about it. Didn't want to be defined by it. So I just became a paramedic and kept my head down. He looks at her. But today, watching you work, I realized something. All that training, all that experience, it doesn't have to be a burden. It can be a gift, if you share it. Maggie turns to him. You sound like a recruiter. I sound like someone who wishes he had a teacher like you when he started. Before she can respond, Kovac walks out of the station. He sees them, walks over. Brennan, before you leave, I need an answer. Maggie looks at him. About what? Training officer position, full-time. You develop curriculum, run field training scenarios, mentor new medics, salary bump, better benefits. I'm 71. You've said that already. It's not a disqualifier. It's an asset. Maggie crosses her arms. What if I say no? Then I'll respect that. But I'll also know I let the best medic I've ever worked with walk away because I was too proud to admit I was wrong the first time. Maggie is quiet. Kovac continues. Look, I can't undo what I did, but I can make sure it doesn't happen to someone else. There are medics out there right now who are getting pushed out because they don't fit some arbitrary metric. And there are new medics coming in who are learning protocols but not principles. You can change that. Maggie looks at Jesse, then back at Kovac. I need to think about it. Fair enough, take the weekend. Let me know Monday. He walks back inside. Jesse grins. You're going to say yes. You don't know that. Yeah, I do, because you didn't say no. Maggie almost smiles. Almost. Her phone buzzes. A text from Dr. Okonkwo. Derek Moss is out of surgery. Stable. They repaired the ventricular tear. He's going to make it. Thank you. Maggie shows the text to Jesse. He reads it, nods. See? That's why you're going to say yes. Maggie puts the phone away. Maybe. They finish cleaning the rig in silence. The shift ends. They clock out. Maggie walks to her truck, tosses her bag in the back seat. She sits behind the wheel, but doesn't start the engine yet. She thinks about Derek, about the rebar through his chest, about the moment she made the decision to do something that wasn't in any protocol, something she learned in a jungle 56 years ago. She thinks about the kids she couldn't save, the ones who died in her hands, despite everything she did. She thinks about the ones she did save, the Marine with the sucking chest wound who walked out of the aid station 3 weeks later, the corporal with the shrapnel in his abdomen who sent her a letter 2 years after the war, telling her he got married and had a daughter. She thinks about all the patients over the last 22 years, the diabetic with the hidden stroke, the MVA victim with the splenic rupture, the overdose patient who walked away, Some you save, some you don't, but you show up anyway. She starts the engine, drives home. That night, she sits at her kitchen table with a cup of tea, looking at an old photograph she keeps in a drawer. It's her, 1969, case on, standing outside a sandbagged aid station, wearing jungle fatigues and a flak jacket, a caduceus patch on her arm. She's smiling, but her eyes look older than 19. Behind her, 3 Marines are sitting on ammo crates, smoking cigarettes. One of them has his arm in a sling. Another has a bandage on his head. They're all alive in that picture. She wonders if they still are. She closes the drawer, finishes her tea, goes to bed. Sunday morning, her phone rings. It's Kovac. I know I said Monday, but I just got a call from the state EMS office. They want to do a feature on the construction site rescue. Media, interviews. They want to talk to you. Maggie sits up. No. Maggie, I said no. It's not about glory. It's about showing people what good medicine looks like. I don't want to be a story. You already are. The question is whether you help shape it or let someone else do it for you. Maggie is quiet. Kovac continues. There's something else. Derek Moss's family wants to meet you. They're at the hospital now. They asked if you'd come by. Maggie exhales. When? Whenever you're ready. She hangs up, gets dressed, drives to the hospital. Regional Medical Center is quieter on Sunday morning. Maggie walks through the main entrance, takes the elevator to the ICU on the 4th floor. Dr. Okonkwo is at the nurse's station when Maggie steps off the elevator. She looks up, stands. I didn't think you'd come. Neither did I. Dr. Okonkwo walks with her down the hall. He's doing well. Off the ventilator as of this morning, talking. His family's been here since yesterday. They stop outside room 412. Through the window, Maggie can see Derek. He's sitting up slightly, still pale, chest wrapped in bandages. A woman in her late 20s sits beside the bed, holding his hand. An older couple stands near the window. Dr. Okonkwo knocks lightly, opens the door. Derek, there's someone here to see you. Derek turns his head. His eyes find Maggie. Recognition is immediate. You. Maggie steps inside. The family turns to look at her. Derek's voice is hoarse, but clear. You're the paramedic. The one who, I remember your face. You told me to stay with you. Maggie nods. I did. The woman beside him stands. She's crying before she even speaks. You saved his life. Maggie doesn't know what to say. She never does in moments like this. The older man steps forward. Derek's father. The doctors told us what you did. That he was dead. That you brought him back with a, I don't even know what it's called, pericardiocentesis. They said no one does that anymore. That it's too dangerous. Maggie looks at Derek. It was the only option. Derek's mother approaches now, her face lined with exhaustion and relief. Thank you. I don't know what else to say except thank you. Maggie nods once. I'm glad he's okay. She turns to leave, but Derek's voice stops her. Wait. She turns back. He's looking at her with an intensity that makes the room feel smaller. I was gone, wasn't I? I felt it. Everything went dark. And then, I heard your voice. You said, not yet. Like you weren't going to let me go. Maggie's throat tightens. You weren't ready. The fire captain told my dad that everyone else on scene thought I was done, that they were going to move on to the next patient, but you didn't. No. Why? Maggie is quiet for a moment. Because I've seen what happens when you give up too soon. Derek's girlfriend wipes her eyes. We're getting married next year. He proposed 3 months ago. If you hadn't in there, she doesn't finish, doesn't need to. Maggie looks at all of them. This family, intact, whole, because of a procedure she learned in a war half a century ago. Derek's father extends his hand. I don't know how to repay you. Maggie shakes his hand. You don't need to. Just take care of him. We will. Maggie leaves the room. Dr. Okonkwo follows her into the hallway. You're not good at accepting gratitude, are you? No. Why? Maggie stops walking. Turns to face her. Because for everyone like him, there were 10 I couldn't save. And gratitude doesn't erase that. Dr. Okonkwo crosses her arms. You carry a lot of weight. Everyone does. Not like you. Maggie doesn't respond. Dr. Okonkwo continues. I looked you up, after yesterday. Your military record is partially declassified. Silver Star for action at Kaysan. You ran an aid station under sustained artillery fire for 4 days, treated over 60 casualties. Saved most of them. Maggie's face is stone. Not all of them. No one saves all of them. I know. Dr. Okonkwo steps closer. So why do you still blame yourself? Maggie looks away. Because the ones you lose stay with you longer than the ones you save. There's a long silence. Dr. Okonkwo finally speaks, softer now. Kovac told me he offered you a training position. Yes. Are you going to take it? I don't know. You should. Maggie looks at her. Why does everyone keep saying that? Because you have something most people don't. You've seen the worst, survived it, and kept going. That's not just skill. That's resilience, and it's teachable. Maggie shakes her head. You can't teach someone how to handle loss. No, but you can teach them they're not alone in it. Maggie is quiet. Dr. Okonkwo's pager goes off. She glances at it, sighs. I have to go, but think about what I said. She walks away. Leaving Maggie standing alone in the hallway, Maggie takes the elevator down, walks out into the parking lot. The sun is bright, the air cool. She stands beside her truck, looking back at the hospital. Her phone rings. Unknown number. She answers. This is Maggie. A man's voice, older, steady. Miss Brennan, my name is Colonel Richard Hayes, U.S. Army Medical Command. I'm calling about the incident at the construction site. Maggie frowns. How did you get this number? Through official channels. I'll be brief. We're developing a new training program for combat medics, transitioning to civilian EMS roles. We're looking for instructors with real-world experience in both environments. Your name came up. Maggie leans against the truck. I'm retired. From the Navy, yes, but you've been working civilian EMS for over 2 decades. And based on what I've read, you just performed a field procedure most trauma surgeons wouldn't attempt. We need people like you. I'm 71. And you have more combat medical experience than most of our current instructors combined. Age is irrelevant. Competence is not. Maggie closes her eyes. I don't want to go back to that world. You wouldn't be. You'd be helping others navigate it, teaching them how to take what they learned in war and use it to save lives at home. No one understands that bridge better than you. I need to think about it. Of course, I'll send you the program details. No pressure. But I hope you'll consider it. He hangs up. Maggie sits in the truck, staring at the phone. 2 offers in 2 days, both asking her to step back into the identity she spent decades trying to leave behind. Doc Brennan. She drives home. The rest of Sunday passes quietly. She tries to read, can't focus. Tries to watch TV, turns it off after 10 minutes. By evening, she's sitting on her back porch, looking at the sky as it shifts from blue to orange to dark. Her phone buzzes. A text from Jesse. Heard Derek's doing well. Also heard the Army called you. You're kind of a big deal now. Still think you're just another medic? She doesn't respond. Another text comes through. This one from Kovac. Monday morning, my office, 8 a.m., please. She sets the phone down. Monday morning, she arrives at the station at 7:50 a.m. Kovac's door is open. He waves her in. She sits. He closes the door, sits across from her. I'm not going to pressure you, but I need to know. Are you coming back? Maggie looks at him. If I do it my way. Meaning I don't teach protocols. I teach principles. I don't care about metrics. I care about outcomes. And if someone wants to learn from me, they have to be willing to hear things that aren't in the textbook. Kovac nods slowly. I can live with that. And I'm not doing media. No interviews, no features, I'm not a story. Agreed. Maggie exhales. Then, yes, I'll come back. Kovac smiles, genuinely. Thank you. Don't thank me yet. You might regret this. I doubt that. He stands, extends his hand. She shakes it. When do you want to start? Today. Kovac blinks. Today? You have new medics in orientation this week, right? Yes, 6 of them. Then I'll start with them. Kovac grins. They're in the classroom right now, Building C. Maggie stands, walks toward the door, stops. One more thing. What? Jesse Park. He's my partner, officially. Done. She walks out. Building C is across the campus. The classroom is on the second floor. Maggie opens the door, quietly. 6 new medics sit at desks, facing a projector screen. A senior medic is mid-lecture, talking about airway management. He stops when he sees Maggie. "Can I help you?" Maggie steps inside. "I'm taking over." The senior medic looks confused. "I wasn't told. You are now." He looks at the new medics, then back at Maggie, then shrugs and leaves. Maggie stands at the front of the room. The 6 medics stare at her. She doesn't introduce herself, doesn't smile. "Turn off the projector." One of them does. Maggie picks up a marker, writes on the whiteboard. "Protocols save lives, until they don't." She turns to face them. "You've all been taught the rules. Now I'm going to teach you when to break them." One of the medics, a young woman, raises her hand. "Who are you?" Maggie sets the marker down. "Someone who's been doing this longer than you've been alive. And if you listen, I'll make sure you're still doing it when you're my age." She picks up a mannequin from the corner, drops it on the floor. "Let's start with something simple. Cardiac arrest. No pulse. What do you do?" A medic answers immediately. "Start CPR. 30 compressions, 2 breaths." Wrong. They all look confused. Maggie kneels beside the mannequin. "First, you figure out why the heart stopped. Because if you don't, CPR is just buying time for nothing." She looks up at them. "Now let's talk about the things they don't teach you in class." 6 months later, the training room in Building C has changed. The walls are covered with diagrams now, hand-drawn anatomical landmarks, photos of real trauma cases, a whiteboard filled with Maggie's handwriting, notes that haven't been erased in weeks because people keep taking pictures of them. 23 paramedics have gone through her program, all of them still working. 3 have already used techniques she taught them to save lives that would have been lost under standard protocol. Maggie stands at the front of the room. A new class of 8 sits before her. This is week 3. She's holding a 14-gauge needle. Pericardiocentesis. You've all heard the term. Most of you will never do it. But if the moment comes, hesitation kills. She moves to the mannequin, demonstrates the angle, the landmarks, the feel. Subxiphoid approach. 45-degree angle toward the left shoulder. You're aiming for a space you can't see. You have to trust anatomy, trust your hands, trust your training. One of the medics raises his hand. "How do you know when you're in?" "You feel it. A pop. Subtle. Then you aspirate, you get blood. Dark blood, not bright. That tells you it's from the sac, not at the ventricle." Another medic, older, maybe prior military, speaks up. "You did this under a collapsed building, without imaging. How?" Maggie sets the needle down. "Because I'd done it before, in places where there was no imaging, no backup, no second chances." She pauses. That's the difference between knowing a procedure and owning it. Knowing means you can recite the steps. Owning means you can do it in the dark, under fire, with your hands shaking, and still get it right. The room is silent. Maggie continues. "You can't learn that from a book. You learn it by doing it. And if you're lucky, you learn it in a controlled setting first. If you're not, you learn it when someone's dying, and you're the only one who can help." She picks up her bag. "That's it for today. Tomorrow we're doing live scenario training. Dress for the field." They file out, all except the older medic. He stays behind. Maggie is erasing the board when he speaks. "You were FMF, weren't you?" She stops, turns. "What makes you say that?" "The way you teach. The way you talk about doing things under fire. I was Army, 2 deployments. I know the tone." Maggie studies him. "What's your name?" "Marcus. Marcus Hale. You have trouble transitioning back?" He nods. "Yeah. Civilian EMS feels slow, safe. Sometimes I feel like I'm not using what I learned over there, like it's just sitting in my head, getting dusty." Maggie sets the eraser down. "It doesn't have to. Everything you learned in combat has a place here. You just have to translate it. That's why I signed up for your class. I heard you were prior service. I wanted to see if you felt the same way." Maggie picks up her bag. "I spent 30 years trying to forget what I learned in Vietnam. Turns out I was wrong. It's not something you forget. It's something you carry. And if you carry it right, it becomes a gift instead of a burden." Marcus nods slowly. "Thank you." She walks out. Jesse is waiting in the hallway. He's been shadowing her classes, learning, asking questions. "You're good at this," he says. "At what?" "Teaching. You don't sugarcoat anything, but people respect that. They trust you." Maggie keeps walking. They trust results. They head outside. The afternoon sun is warm. Maggie's truck is parked near the edge of the lot. Her phone rings. She checks the screen. Colonel Hayes, she answers. This is Maggie, Ms. Brennan. I wanted to follow up on our conversation from 6 months ago. The Combat to Civilian Transition Program is launching next quarter. We still need a lead instructor. The position is yours if you want it. Maggie leans against her truck. I'm already teaching. I know. I've heard. Word travels fast in military medical circles. What you're doing locally is exactly what we need nationally. This would be a contract position, 6 weeks a year. You'd train the trainers. Teach other veterans how to do what you're doing. Maggie looks at Jesse. He's watching her, listening. I'll think about it. That's all I ask. I'll send the details. He hangs up. Jesse grins. You're going to say yes. You don't know that. Yes, I do. Because you finally figured out what the rest of us already knew. What's that? But you're not done. You're just getting started. Maggie almost smiles. They drive back to the main station. It's shift change. Medics coming and going. Rigs being cleaned and restocked. Maggie walks inside. Kovath is in his office, sees her through the window, waves her in. She steps inside. Got something for you, he says. He hands her a framed certificate. It's from the state EMS board. Commendation for outstanding field medicine. Her name is printed at the bottom. She looks at it, then at him. I said no media. This isn't media. This is recognition. There's a difference. She sets it on his desk. I don't need this. Maybe not. But the medics you're training do. They need to see that doing the right thing, even when it's not in the protocol, gets recognized, not punished. Maggie picks up the frame again, looks at it. You can hang it in the training room, Kovac says. Let them see it. She nods. Okay. She leaves, takes the frame to Building C, hangs it on the wall near the entrance. Jesse walks in, sees it. Look at you, getting famous. Shut up. He laughs. A call comes over the radio. All available units, mass casualty incident, warehouse fire, multiple victims, respiratory distress. Maggie and Jesse look at each other. They run to the rig. Lights and sirens, the city blurs past. On scene, smoke is pouring from a massive industrial warehouse. Firefighters are pulling people out. Dozens of workers, coughing, gasping, collapsing on the pavement. Maggie steps out of the rig, surveys the chaos. She's 72 now. Silver hair, weathered hands, a body that's slower than it used to be. But her mind is sharp, her instincts sharper. She moves into the chaos like she's done 1,000 times before. Triage, assess, treat, move. Red tags, yellow tags, green tags. Jesse is beside her, following her lead. Other medics arrive. They see Maggie, adjust their approach to match hers. She's not the fastest anymore, but she's the most efficient. Within 30 minutes, every patient is categorized, treated, and transported. 0 deaths. Kovac arrives late, after most of the work is done. He watches Maggie from a distance, directing medics, organizing chaos into order. He shakes his head, mutters to himself, I almost fired her. A firefighter nearby overhears, grins, glad you didn't. As the scene clears, Maggie stands near the rig, catching her breath. Her chest is tight, her legs ache, but she's steady. Jesse hands her a bottle of water. You okay? Yeah. You sure? You're not as young as you used to be. She glares at him. Neither are you. He laughs. They pack up, head back to the station. The sun is setting now, casting the city in gold and shadow. Maggie looks out the window, quiet. Jesse glances over. What are you thinking about? She's quiet for a moment. I'm thinking about a kid I treated in 1968. Name was Danny. He was 19. Took shrapnel to the chest. I did everything I could, but he didn't make it. Jesse doesn't interrupt. Maggie continues. For a long time, I thought about him more than the ones I saved. I carried him. All of them. The ones who didn't make it. She pauses. But today I realize something. I can't bring them back. But I can make sure the people I teach don't lose as many as I did. And maybe that's enough. Jesse nods. It is. They pull into the station. End of shift. Maggie climbs out, stretches, grabs her bag. Jesse stops her. Hey, for what it's worth, I'm glad you didn't stay retired. She looks at him. Me too. She walks to her truck, drives home. That night, she sits at her kitchen table, looking at the old photo from Quezon again. She touches the faces of the Marines standing behind her. Wonders where they are now. Hopes they made it. She opens her laptop, pulls up the email from Colonel Hayes, reads the details of the program. 6 weeks a year. Teaching veterans how to transition their combat skills into civilian life-saving. She hovers over the reply button. Then she types, I'm in. Sends it. Closes the laptop. She stands, walks to the window, looks out at the quiet street. Her phone buzzes. A text from Jesse. Just got called back in. Multi-vehicle MVA. They're asking for you specifically. You available? She looks at the clock. 11:47 p.m. She texts back. On my way. She grabs her keys, her bag, heads out the door. At 72 years old, Maggie Brennan is not done. She's just hitting her stride. The engine starts. The headlights cut through the dark. She drives toward the scene, toward the chaos, toward the work she was always meant to do. Behind her, the photo on the table sits in the quiet house. A young woman in fatigues, standing in a war zone, surrounded by the people she saved. Doc Brennan. Then, now, always. The screen fades to black. A final message appears. Maggie Brennan continues to teach at regional EMS and consults nationally on combat to civilian medical transition programs. Derek Moss made a full recovery and married his fiancée 8 months after the incident. He named his first daughter Margaret. The words linger, then fade. What would you have done in Kovac's position? Tell us in the comments. And if you haven't yet, subscribe to Emergency Heroes Stories, because real heroes don't retire. They evolve.